I'm Dr. Laura Smith. I am a radiologist for Princeton Baptist Medical Center as well as Baptist Imaging Hoover. My radiology group reads all of the mammography for those two facilities. I'm sorry I couldn't be here in person, but today I wanted to talk a little bit about breast health and the importance of screening mammography. I know with COVID, the last couple of years, women have missed their screening mammograms, and I wanted to explain the importance of getting screening mammograms every year because it detects early breast cancer. If we screen every single year with mammography, we can compare your old exams and detect any changes that may have occurred since the previous study. So why is this talk important? Why is screening mammography important? Well, unfortunately, breast cancer occurs in about 1 out of every 8 women. So that's a pretty large percentage of the women sitting in this room right now. I enjoy radiology and breast imaging because I feel like it gives me this opportunity to help women to find early breast cancer and to really just serve my community in that way. Because I can't be there today with you in person, I've put together some questions regarding breast imaging, breast health that I've been asked in the past that I thought may be a benefit to you guys. So just to get to the basics, what is a mammogram? A mammogram is a radiological study. Usually it's 2 views of each breast that we perform every year, and the purpose of a screening mammogram is to detect early breast cancer. It is a view of the breasts, and there are various things that as radiologists we look for on the image to let us know our suspicions of whether you may have a breast cancer or not. Routine annual screening mammography is important because it helps us detect early breast cancer. This is the main goal of screening mammography. Small changes can occur in the breasts over 1 year, and so coming every single year to get a screening mammogram helps us to detect early breast cancers before they become larger or more invasive or develop spread throughout the body. Because of the challenges that COVID has presented over the past couple of years, a lot of women have skipped their screening mammograms out of fear of COVID exposure at hospitals or imaging centers. It is important, despite this unfortunate pandemic that we've had to go through, to get your annual screening mammogram, because even if you skip a couple of years, you could be missing out on detecting an early breast cancer. I know a lot of women have been afraid with all of the COVID going on to come get preventive screening exams done at both hospitals and imaging centers. Our technologists and staff do still wear masks around the patients. There's intense cleaning of the mammography unit as well as the public spaces. And so I don't think the fear of COVID exposure should be preventing women from getting their screening mammograms. There's 2 types of mammograms. There's 2D mammography, which is a traditional, the earliest type of mammography. And in the past recent years, they've developed something called 3D mammography or 3D tomosynthesis. This 3D technique is a way to look at the breast tissue a little bit more layer by layer instead of just looking at it all in one picture. So it allows us to scroll through each layer of the breasts, and I've found it most beneficial in women with dense breast tissue, as well as in women that have had previous breast biopsies or surgical changes to tell whether there's anything hiding in all of the post-surgical scar. So you may ask, what are you talking about dense breasts? So women who have their mammograms every year, you may have noticed you get a letter after you've had your mammogram that tells you whether or not you have dense breasts. So having dense breasts just means there's a lot of tissue that we see on the mammogram, and it's a normal finding, but it can lower the sensitivity of finding a small breast cancer within that tissue. The opposite of a dense breast would be a more fatty breast, so that there's not as much tissue that would obscure a breast cancer. So all in all, it's more difficult to find breast cancers in dense breasts compared to fatty breasts. Another important component of breast health is the importance of monthly self-breast exams. And so your primary care doctor may have told you to evaluate your breasts every month and just feel around and see if you feel any lumps or bumps. So in addition to screening mammography, which we get every year to just detect asymptomatic breast cancer, we also work up patients that have these lumps and bumps they feel on their breasts. So we do diagnostic mammography, we evaluate the breast with ultrasound, and you can also evaluate the breasts with breast MRI depending on the clinical situation. So in addition to just getting your annual screening mammograms, it's also important to do self-breast exams, because oftentimes women will feel a lump or bump that concerns them, or their doctor may feel it, and we as radiologists help them work that problem up with imaging to determine whether it's an early breast cancer or if it's another lesion such as a benign breast cyst. So sometimes women will develop lumps or bumps in their breasts between the times of their yearly mammograms. And in that case, the patient may come in for what we call a diagnostic mammogram and ultrasound. And so that's another service we offer in addition to just the yearly screening mammograms. So whether or not you feel a lump or bump between your mammograms, or if it's something that we found on your screening mammogram, we can work you up with mammograms and ultrasounds to determine whether something that you or your doctor feel in your breast is just a breast cyst or just breast tissue, or if it's actually a breast cancer. So not to leave the men out, breast cancer also occurs in men. And so oftentimes we will have men that come in with lumps and bumps in their breast that either they feel or their physician felt, and we can determine whether it's just a benign enlargement of the breast tissue or a benign lesion in the breast, or whether it's actually a breast cancer. While men don't typically undergo annual screening mammography, they can be evaluated with both mammogram and ultrasound to determine whether a lump or bump in their breast is something cancerous or benign. So you may be wondering, what is the radiologist's role in breast health and helping patients stay on top of their breast health? So I would explain it like this. A patient comes to you see your primary care doctor once a year, sometimes more often than that. Typically, at least once a year, your primary care doctor will do a breast exam, or your OBGYN will do a breast exam and look for lumps or bumps themselves. If everything's okay, all is well. They'll send you for your screening mammogram. If they feel a lump or bump, then they'll send you to an imaging department to get a diagnostic mammogram. And so we receive patients that are either just here to get their screening mammograms every year, they're not having problems, or we get patients that have a symptom such as a breast lump or even nipple discharge or skin discoloration or anything really related to the breast. And as the radiologist, our role is to work up that problem and help the patient and the referring doctor to determine whether it's a possible cancer or if it's just a benign problem. So the patient will come to our imaging center and either get their screening mammograms or a diagnostic mammogram with ultrasound. And based on how we interpret that exam, we'll recommend either it's a benign lesion and just go back to your screening study. We may say that it's a probably benign lesion with a less than 2% chance of having breast cancer. And in that case, we typically would ask for the patient to come back in 6 months instead of 12 months for a follow-up exam. If it's something that looks suspicious by imaging, we would recommend a biopsy. And usually the patient is told on the same day of their diagnostic imaging whether a biopsy is recommended or not. So all of that information goes to the patient's primary care doctor, and the primary care doctor will set the patient up with a surgeon if needed, or any other further care at that point. So as radiologists, we're kind of the middle person as far as helping the patient and their physicians work up any kind of breast problems. Baptist Imaging Hoover has just gotten a new 3D mammography unit as of June 2022. We're very excited about this new addition to the imaging center, and I think it will help us with our diagnosis in detecting early breast cancer. The Princeton Diagnostic Center does also have plans to get a 3D mammography unit at a later date. So if you're wondering how you could schedule a 3D mammogram at our Hoover facility, I have the number here for you. You can call 205-949-4900 and get your 3D mammogram scheduled. I hope this has been helpful in learning a little bit more about breast cancer screening with mammography. I'm sorry that I couldn't be with you guys this morning, and I hope you have a good day.
There's so much misconception about what a mammogram actually is. The mammogram has a horrible reputation that precedes it, but it is just technically it's X-ray of the breast.
And its ideal design is to catch early signs of breast cancer.
The reason that it's important to get a mammogram is because early detection is best. If you get your mammogram when you're supposed to get your mammograms and we find a cancer early, we can take care of it and get it done before it can spread anything else.
Through the current technologies that we do have, we are able to detect breast cancers a lot earlier than you would be able to doing a self-exam at home or even going to your doctor's office and having them do a physical exam on you.
Beginning at the age of 35, women should have their baseline mammograms. At 40 is when you begin having your annual mammograms.
Particularly if you have a history of breast cancer in the family, that's an individualized discussion that you would have with your doctor to decide when you should start.
They could start earlier, annual mammograms earlier than 40, depending upon the family history.
What should you expect when you come to get a mammogram? Well, it just depends on your attitude when you get here. So I think sometimes people come in here with the attitude of, or thinking that this is gonna hurt, my mom says it's horrible. And they come in here and we do it and they go, oh, that didn't hurt at all.
Different women experience it differently. Of course, if you're on your menstrual cycle, if you have intake of caffeine, so certain things like that can affect your overall sensitivity level. However, most people walk out the door saying, oh my goodness, I can't believe it was that easy. I can't believe I didn't feel anything.
It's a lot easier now, a lot better. It doesn't take very long at all.
The patient's actually only going to be in the room for maybe 10 minutes. The actual procedure is less than 20 seconds each position. That's just taking the time to position it and to make the picture.
If you have breast implants, we do take more images. We have to do pictures with the implant in place, which we barely touch you with the paddle. We do not compress the implant. And then we'll take pictures, what's called pushbacks. We push the implant back out of the way and get as much breast tissue as we possibly can.
We're all trained in doing it, and yes, you will have to go through 4 more pictures than everyone else, but it's not any worse.
I would recommend dress casually, comfortable, something that you can kind of get in and out of because you will be undressing from the waist up, so top and bra.
To be perfectly honest, it's an awkward situation. I mean, you can't avoid it being awkward, but they make it as comfortable as they possibly can. Only one side of you is exposed at any given time.
We recommend that you don't wear any type of deodorants or any type of lotion with glitter in it of any kind. The machine is so sensitive and it'll pick that up, and we definitely do not want you having to come back for something such as glitter or deodorant.
A woman should never be nervous about coming to have a mammogram. You should be nervous if you don't get a mammogram.
1 in 8 women will develop breast cancer in their lifetime.
And a mammogram is the easiest way to detect a breast cancer early.